I'm curious to know, I imagine that from time to time, inaccuracies or mistakes get made in electronic health records, these being human artifacts. How do you resolve those kinds of the issues that might arise from inaccurate information in these records? Gail, your perspective?
Well, I don't think this is a different problem than we had in paper, actually. I mean, if you have patients that are not the best historians at the time, for example, you have people forget what allergies that they have. You have them admitted in different states and their family providing the information. We had a lot of questions about this from our providers about as we bring in other information. I do think what we've decided to do is really make it clear, where did this information come from? Was this a physician? Was this a nurse? Was this a pharmacist? So that the clinician looking at the information can make some judgment calls on the validity of the information.
You know, I'm not a handwriting analyst, but I'm always grateful when my pharmacist can figure out what my doctor has prescribed for me. I think I look forward to the day when they can just call up my information on a screen. I'm gonna have a sense it's likely going to be more accurate.
Yeah, indeed.
Barry, I would just say I'm grateful that my pharmacist never has to interpret my physician's handwriting, because he or she orders my medications directly from the computer terminal. I would also just say that ready access by the patients themselves to the electronic information is a great way to make sure that it's accurate. The electronic record also helps to make sure that it's not just the accuracy of the clinical record, but it's the accuracy of the instructions that the patients walk out of the exam room with. It's, I would argue, an even more significant issue. With electronic records, it's a couple of clicks on the screen and the patient's walking out with a printed after-visit summary with a list of instructions, in whatever they might be. Compliance with instructions is a huge clinical care problem. These electronic systems are doing a great job of making sure there aren't mistakes or misinformation that the patients take with them.
This is a bit
I don't think you could underestimate the role of the patient in both correcting things that the patient, that the clinician misunderstood, that the histories of or laterality of a condition. So I think that they serve as that kind of check and balance. The other thing that has happened, and I think that we all probably have stories of this, as a test ordered, in our case, for example, the resident rotates off service, and it's really the patient that catches the condition. So they really do serve as that next safeguard of identifying misdiagnoses.
Well, related to this, we're going a little bit off topic here, but I'm curious. Cyberchondria, internet access to healthcare information, on balance, a good thing, or just a very challenging thing for healthcare providers to deal with?
One of the things that VA did early on was, in our personal health record, was provide health information from trusted sources. So we collaborated with the Department of Defense to provide direct linkage to trusted health sources, because otherwise, we have patients coming in with volumes of information from all kinds of sites. So I do think it's essential to help the patient go to those sites where the information is valid and pertinent.
I would ditto that comment, but also say we welcome patients who walk in with a lot of information. Now, this is a patient who's engaged in his or her care, and it's our responsibility to sort through an overwhelming volume of information and to be an advisor, a trusted expert, a consultant in making clinical decisions. So we prefer patients that have walked into our exam rooms with a whole lot of research.